For a moment, let your thoughts drift across the people in your life. Think about friends, family members, co-workers, the people at your church, and the Lord himself. Think about music, pets, your work, medical care, food, clothing, shelter, and all else that touches your life. What thoughts spark feelings of gratitude? As you meditate on these blessings, plant the gratitude you feel deep in your heart. Heavenly Lord, we come to you tonight and we thank you for the ability to be here together. We thank you for all those in our lives that provide us care and those who we provide care for. And we know that you are in the mix of all of that, and you strengthen us and you guide us. Give us tonight the peace that we so need as we journey on this caregiving journey. And help us to feel that gratitude and to identify all the ways that you provide for us. In your name we pray, amen. So a couple follow-ups from last week. I talked about the AARP planning guide, and I did have many copies. Well, Clarence Montano got more copies, and so there's plenty of the AARP planning guide on the table, plus some of this devotional and a couple other devotionals, plus those gratitude cards that we talked about last week. So if you didn't pick up gratitude cards, I pick up some of those. And then I'm looking over there to see what else I have. Oh, and some of the Chicken Soup for the Soul books. And then there's a couple other planning guides that as I went through the books that we're going to be bringing throughout the series, there were a couple other planning guides. One of them is toolkits for the caregiver. So if you need something for that planning guide to help you on some of the things we talked about last week, please go ahead and pick one or more of those up as you leave tonight. Okay, I'm gonna turn it over to Jeff.
Hello and good evening. Today I get the pleasure of introducing Dani Nichols. Dani's going to talk about some different living options for people as they go through the aging process. Dani's an occupational therapist at Westview Health Home, graduated from the University of North Dakota, and also a master's degree in occupational therapy. And Dani's especially passionate about dementia care. She works closely with people with the different types of dementias. She has 20 years of experience in skilled nursing and long-term care. And when she's not working, she actually has fun. She has been married for 19 years and has an 11-year-old daughter who's very involved in her local gymnastics. And she's supposed to have a PowerPoint presentation, but somehow we can't get the technology to work. So she's going to just speak to us tonight. Come on up, Dani.
Can you guys hear me?
No. I can fix him.
How about now? All right, my name is Dani. Thank you for having me here and giving me the opportunity to visit with you. I am going to talk about nursing homes and some other options as our loved ones and ourselves go through the aging process. So we're going to start with independent living. Independent living means that you are being as self-sufficient as possible. It means that you are able to take risks and you're allowed to fail or succeed. Independent living means exercising the greatest degree of choice about where you live, with whom you live, how you live, where you work, and how you use your time. Independent living means you do not need assistance to remain safe and healthy. So that's how most of us are functioning. So next, let's talk a little bit about assisted living. Assisted living is a bridge in between independent living and long-term care. Assisted living is a type of housing and care for individuals who need some care with daily activities of living. Daily activities of living are things like dressing, moving, bathing, using the bathroom, those are examples of daily living tasks. When you're in assisted living, those people that work there are able to provide assistance with those activities of daily living if needed, but they also supply assistance with medication management, meals, and housekeeping tasks. So those higher living or higher level cognitive tasks that take a little bit more cognitive powers and brain powers and competence. Assisted living offers social and recreational activities, and those things are hugely important, not only when we're younger, but as we age, to keep active, keep our minds moving and thriving. Typically, individuals who reside in an assisted living facility need to be able to move without assistance. So my experience has been with the residents that I've treated, patients that I have treated, as long as my patients are able to stand up and move and get from point A to point B without having to have it hands-on assistance, they're pretty good to stay at our assisted living facilities locally until they need more assistance. Skilled nursing facility is an inpatient facility that provides short-term and long-term care and rehabilitation services. So short-term care refers to individuals who maybe have had a hospital stay, they've been weak, they're falling more at home, and they need some therapy or nursing services to be able to return back to their prior level of function or to their home where they were. The long-term care part refers to individuals who are no longer able to care for themselves due to a physical or cognitive impairment. Well, I think one of the things in my experience that is really a struggle for caregivers is how do you talk to someone about how that they need more assistance and need to move to a greater level of care. There isn't anyone who wakes up and says, I hope that I spend my remaining days in a nursing home or an assisted living facility, right? That's not our goal. In my experience, my best advice is don't make a promise you can't keep. It sounds, your mom or your dad or your grandma or your grandpa says, please don't put me in a nursing home. You say, absolutely, I will never do that to you. The reality is you don't know. And that's really, really difficult when you get to that point of having to think, well, I made my mom a promise that I would never put her in a nursing home, but it's really hard for me to take care of her. Be honest. Have a good conversation with your loved ones about what's going to happen when you can't stand up anymore or you can't go to the bathroom. What are we going to do? What's our plan? I have seen not a lot, but people who will trick, for lack of a better word, their loved one and bring them into skilled nursing and then drop them off essentially. It's hard to have that conversation and it's really tough for not only for the family, but for the person that now feels abandoned. And that's how it feels. So be honest with your loved ones about what the next step is. What is the plan? Try and keep a positive, upbeat, and soft tone. Compassion and empathy are really, really important when we're having these conversations. Be kind and be honest. Hey, Mom, I really want to keep you at home, but I can't do this anymore. I need more help. Use the phrase for right now. For right now, you're going to come to the nursing home or to Sugar Land Ridge. And for right now, this is where I'm going to have you stay so that you're safe and taken care of. Make visits to the community before move-in day. It's hugely important to know where you're taking your loved one and so that they know where they're going. Get them comfortable with the environment, whatever the environment is, whether it be having a new caregiver come into your home to take off some of that burden that you're having, visiting the assisted living facility, going to have a meal there, taking a tour of the nursing homes in the community or skilled nursing facilities, and just be really educated on what your options are. And be easy on yourself. Be kind to yourself. It's normal to feel guilty. It's normal to feel overwhelmed. but show yourselves a little compassion. It's a hard job to be a caregiver. Go easy on yourselves, which is really easy for me to stand up here and say. How do you know when your loved one needs more help? So changes in physical health, they need more help standing, they need more help walking, steps are harder to navigate. There's a cognitive decline, difficulty remembering where they are, what time of the day it is, if they've had breakfast, lunch, or dinner. Is your loved one neglecting their personal hygiene? Are they not combing their hair? Are they not bathing? Are they having troubles with incontinence? And they're embarrassed by that. So you open a drawer and you find soiled undergarments. Those are signs that self-care is getting much more difficult. Increased dependency, so needing more help. They're calling us as children, as friends, as other family members, and asking for more assistance. Can you go to the grocery store for me? I can't find my keys. Do you know when my bills are due? Just asking for more and more help. Becoming socially withdrawn or isolation. That's a big deal. I think as we went through the COVID pandemic, it became very clear what a negative impact being socially isolated can have. But if you're having more difficulty and you can't keep track of a conversation and it's uncomfortable to be in with a group of people because you can't remember what is being said, it's not uncommon for a person experiencing that to withdraw a little bit. Erratic or forgetful behavior or personality change. Someone, maybe your loved one was someone who was kind and calm, and now the littlest change in their schedule really causes them to be irritated or feel frustrated. Safety concerns. Falls. Is your loved one falling more? Are they getting lost when they go out into the community to get groceries? Those are big indicators that maybe things aren't going as they could be. And lack of proper nutrition. It gets harder to make a good meal when it's harder to move. So nutrition starts to decline, which then causes increased weakness, which then causes increased falls. It's kind of a stair-stepping mechanism that begins to happen. One of the big things is caregiver burnout. It sounds super easy to say, I'm going to take care of my wife, my mom, my dad, my husband. It's a 24-hour day, 7-day-a-week job. And being able to recognize in yourself that you need more help, that you're struggling, is a big deal too. And we're very lucky to live in the community that we do. We have a ton of resources in Sheridan to help with that. Caregiver support groups, lots of community outreach services that can come into the home. Just, it's so important to be able to recognize in yourself when that caregiver burnout comes and if you need more help to keep your loved ones safe, healthy, and at home. Any questions so far?
Talk about assisted living, but when you say that business or assisted living as in the home?
So that what I was referring to was a facility like Sugarland Ridge or Cascades. I cannot keep track of what the name of it is. It's changed frequently. That's an assisted living facility. So, and I think Dee's going to talk a little bit about that as well. There's a couple of options at the assisted living facility here, more independent living and then more apartment style living. So in that instance, I was referring to more of a facility.
So it's not like they're living in home with assisted.
Correct.
And what do you call that?
That assisted living is a great explanation of that. So that's in my world, in therapy world, that's more in-home assistance versus assisted living. Did I answer your questions? You're welcome.
Yeah, thank you.
One of the things that gets really confusing as caregivers and care partners start looking into different options is how are services paid for? So when we talk about independent living, that's on us. We have jobs, we have social security, we have income coming in that pays for that. When we start talking more about an assisted living facility, payer can depend on the facility. Sometimes there's regulations that vary state by state. In our county, our assisted living facilities, Sugarland Ridge, and then Willow Creek on Avoca is all private pay. Cascades or Sugarland, they used to have 2 rooms that were Medicaid. I do not believe they have those 2 rooms anymore. So it's a private pay situation, which is really tough. When we talk about skilled nursing facility, there's some different sorts of payers for that. Susan and I were actually talking just briefly before I came up about a long-term care insurance. That's pretty rare. In my 20 years as a therapist, I can only count maybe a handful of times I've had patients that have had long-term care insurance that covers the room and board. What we see on a short-term care basis is if you've been in the hospital for 3 midnights and you have a need for skilled nursing, which is medications or an infection like UTI or pneumonia, IV treatments, or wound care, you can access your Medicare Part A benefits. That covers room and board, that covers your nursing care, that covers all supplies. There's a caveat with Medicare Part A. You have 100 days that are available to you, but the person who's accessed that benefit has to have a skilled need. So that's nursing or rehab. As long as nursing is providing wound care, IV medicine, Medicare will continue to cover. For therapy services, if we're providing therapy services and we're able to document that we're making progress with our plan of care, Medicare will continue to pay for that. But once those services end, Medicare stops paying, and that gets a little gray sometimes when we start talking about that. The other caveat with Medicare Part A is 20 days are paid at 100%. On day 21, there's a copay, which can either be paid privately, and I believe offhand that number right now is $153 a day, or supplemental insurance. So things like AARP, United Healthcare, Humana, and Medicaid will pick up that 20% copay. The other option for paying for skilled nursing facility is Medicaid. That has to be applied from the state. There's a pretty lengthy, kind of rigorous process to go through, but we're also lucky in the community. We have a lot of resources and a lot of people who can help walk through that. And that is dependent on income. I believe the number, the income based is $2,000 or less. Don't quote me on that because I'm not sure if that number has changed. The other thing that often comes up when we talk about Medicaid, so if you are a spouse and your husband or wife is in the nursing home and you need to pay for that care and you apply for Medicaid, if you still live in the community, Medicaid will not take your house, they will not take your car. They allow for there to be a spouse in the community, but will pay for the nursing home care. That gets really confusing for people sometimes too. The last option for skilled nursing is a private pay situation. And I'm not gonna lie, nursing home care is uber expensive. So to give you an idea, and all of the facilities in Sheridan are pretty comparable. At Westview, a private room is $393 a day, or $11,970 a day. A month, thank you, not a day. Phew! A semi-private room is $328 a day or $9,840 a month. It's astronomical. Another way that I like to break that down to think about it is for a private pay room, that's $16 an hour. That $16 an hour includes your meals, your nursing care, all your supplies, 24-hour a day care, 7 days a week. For a semi-private room, that's $13 an hour. And again, that rate includes the meals, the supplies, housekeeping, laundry. It doesn't include medications, I don't believe. So what is your role as a caregiver? Your role as a caregiver, once someone is in a skilled nursing facility, that changes the role a little bit. It doesn't mean that you stop being a caregiver, because that's a role that becomes part of us and part of our identity. But your role gets to change. You get to come spend time with your loved one and just be a mom. Mom gets to be mom, you get to be a daughter or a son or a granddaughter or a grandson. You have the ability and the option to let the facility that you have chosen, whether it be a skilled nursing facility or assisted living facility, take on the role of the caregiver. They get to do the hard stuff. They get to remind about medications, convince your mom or dad or grandma or grandpa to take a shower, to help them get dressed, and to help them get clean. The thing that I really encourage caregivers to think about is allow yourself time to grieve, making the decision to place your loved one in a home, whether it be assisted living, a nursing home, and asking for more help in the home so that you can step away is a grieving process. It is completely normal to feel guilty about having to ask for help or feel guilty about putting your loved one in a facility. It's okay to be angry. It's okay to feel sad. And maybe you'll get to a point where you can accept that decision, but maybe you won't. Maybe you'll always feel guilty about that. And those are completely normal things to feel. My best advice to you is to communicate. Communicate not only with your loved one, but with the facility that you choose to have your loved one go to, or with the care partner that's coming into the facility. Tell the facility as much as you can about your loved one. Working in skilled nursing, the more I know about your wife or your husband or your parents, the better care I can provide, because I can tailor my treatments and my care and my interventions to who they are. So if I know that they don't like to get up until 10 o'clock and they never ate breakfast, I'm not going to go in and get them up at 7:30 and tell them that they have to eat breakfast. That doesn't make sense. If you're upset about something, talk about it. One of the worst things that I've seen happen is things fester and build, and then every little thing makes you angry. Working in skilled nursing, we're not perfect. We make mistakes. We try really hard not to, but we do. And we want to know if we've done something that has upset you, because we can't fix it if we don't know. If you're happy about something, talk about it. We want to know if you are pleased with the care that your loved one is getting. Our families become just as much a part of us as our residents do. We care for every one of our families as much as we do our residents. And again, communication is key. Things to expect from your loved one is sometimes your loved one feels relieved that they're someplace safe, that they're not putting that burden on you any longer to be the one that's responsible for taking care of them. But your loved one may also experience what we call transfer trauma. They're going to be really mad at you because you put them somewhere that they didn't want to go. They may feel sad. They may withdraw. They may be angry. They may have a loss of appetite. They may be really anxious, and they may feel like they're being treated unfairly or tricked. And all of those feelings are very normal. How to keep your loved ones safe. Have a good support system, whether you're at home, whether you're at an assisted living facility, or your loved ones in a skilled nursing facility. Allow yourself to have a break. We talked a little bit about the caregiver burnout. It's real and it's hard. Give yourself time to step away. Community services to decrease the burden. Again, we're so lucky to live where we do and have so many community resources that can come in. We have people that can be a companion. We have people that will do meals. We have people that can come in and make a meal. Use your resources to help you if you need a break. A respite stay, that's an option too. So if you have a loved one at home and you are taking care of them and you want to go see your granddaughter or your grandson or your children, the facilities in Sheridan offer respite stay. Bighorn Rehab and Westview offer respite. It's an option for you. But I will tell you the caveat is, I can't speak for Bighorn Rehab, but at Westview, we have to have the availability in the room and staffing to be able to take the respite. Again, communicate with your facility partners regarding your concerns, good or bad. Be an advocate for your loved one. Advocate for what you know they like. Advocate for the things that you believe that they need and ask for help. Any questions so far? Anything else that's come up?
Vicki, you mentioned the Medicare Part A limit is 100 days. Is that an annual thing or is that a lifetime? Or do you know?
I do know. So in order to, once you have that 3 midnight hospital stay and you access that benefit, if you, let's say you use 40 days and you go home. If you return home and find that it's not going well, Medicare has what we call a 30-day window, and you can bring your loved one back to Westview or Bighorn Rehab or the TCU, wherever your preference is, and you can resume your Medicare days. If you are outside of that 30-day window and you have another Medicare, 3-night Medicare stay, but there hasn't been 60 days of wellness, which means 60 days of no hospital stay, the 100 days doesn't start over. If you have any remaining days, you can use those.
It's a lifetime. It's 100 days in my lifetime.
No.
That I feel.
So if you have, once you have that 60-day break of wellness, those 100 days start over again. It's kind of confusing. Any other questions so far?
Susan, on our itinerary, is there a section that's for Medicare and Medicaid?
Thank you for asking. We are going to have a panel later in the program. And I can tell you when.
October 21st.
October 21st, and it's going to be Medicaid, Medicare, and long-term care insurance.
That'll be quite helpful, I think.
So I had a question on Medicaid. But I'll save it for then.
Okay.
If I remember. Basically, and here's okay, with Medicaid, if you are a couple, so if you're single and have to use, you're on Medicaid, Medicare covers part, Medicaid covers the rest. But if you have resources to pay for Medicaid, then that gets tricky.
Yes. Yeah, that'll be,
Those up first. What's that? So use those up first.
yeah, they will use your, she's right, they will use your resources first.
Right, and so with, I had a parent that was on Medicaid, we had to get that, so just to let you know.
Yeah. It gets confusing and that's a little bit out of my wheelhouse.
Yeah. Okay.
Yeah, in regards to the respite care in a skilled facility where an individual, say we have to leave, as a caregiver has to leave, and we need to put them into a respite type situation. What are the steps? Are there some guidelines out there somewhere that we know? I mean, to be able to get something from the doctors, whether there's one or many, and then I think we suggested they have to have a room in the facility. You said, Bighorn, and what are the others?
Westview. And yes. So the question is, what are the steps if you have a patient or a loved one who needs respite care? What are the steps to get them respite care? So I'll start with that. And I'll speak to Westview because that's the system that I'm the most familiar with, but it should be pretty close to similar for Bighorn Rehab. So we are required to have an order to admit to the facility. Typically, that can come from the primary care provider, whether it be Dr. Ackerman, Dr. Hall, whoever that person is. We like to have a list of medications and then just some past medical history, because we want to make sure that we can meet the person's or the individual's needs. We want to make sure that we are good fits and can provide good support. If my best advice is if you need that respite stay, to call Westview and we'll walk you through those steps. We'll tell you what you need. We will help you get what you need. We will make sure that everything is in order. Did I answer your question?
And, who do we call? I didn't quite hear it.
So at Westview, that person's name is Tracy. And at Bighorn Rehab, you would just need to ask for their admissions coordinator.
And as far as if the individual is requiring a wheelchair, whether it's power, if it's a power chair, are they allowed to have that in the facility, or do they have to do manual?
No, you can have, at Westview, you can have a power wheelchair. We have a couple of patients there now that have a wheelchair. Our biggest concern with a power wheelchair is just safety. We want to make sure that they're safe with their chair, but yeah, that's not an issue.
And if they're required to use a Hoyer lift, do your facilities utilize that to get the patients in and out of bed and all that stuff?
Yes, ma'am.
Good, thank you.
You're welcome. That was the end of my presentation. Any other questions that I can answer for you?
You mentioned that respite care is dependent upon resources, staffing, room availability, and that sort of thing.
Yes.
You ever run into a situation where you have to tell somebody, no, we just can't do it?
Doesn't happen very often, but yes. We typically have the availability.
What is the respite care? Does Medicare pay for the respite care, or does that become private? That
That,
has to be private pay.
so private pay is an option. Medicaid is the other
So
option.
if they're not on Medicaid, it would be private pay at 3 something and.
Yes, ma'am. I know, makes your skin crawl a little, doesn't it?
I don't really need to go for that week's vacation.
It's expensive.
Well, and just to let people know, sometimes I think everybody thinks of a nursing home as someplace that's where they're going to die, okay? And some of them are near death, but my mom's been here in Sheridan, coming up 4 years. Well, not Sheridan, she's been in a nursing home for 4 years, unfortunately due to COVID. But there's some that they don't last very long. So I think you need to understand that sometimes you have to look at what you need for help, and that it's not an end of life. If you go in and get the time to enjoy, I go see my mom 3-4 times a week, and the nurses say she's so lucky. And to tell you the truth, I think that's why she's doing so well. I mean, she was at end of life a few years ago, and I moved her from Casper to here, and she's come out of comfort care, and she knows she's loved. I think that's an important thing.
Yeah, thanks for sharing that. That speaks near and dear to my heart for sure. And absolutely it's not going to a skilled nursing facility isn't the end all. I will tell you from my experience, our residents are spoiled rotten. We take really, really good care of our people. Most people who go into long-term care, it's not for everyone. It's a hard job. You have to love what you do. It's a hard job.
Doesn't want to go to all facilities.
That's really hard. That puts you in a really, really awkward and hard spot. And everyone's situation is a little bit different. Everyone approaches it a little bit different. But being honest is important and making sure that you and your loved one are safe. Those are the really big things. I wish I could tell you how to get your loved one there, but I don't.
I want to stay at home as much as possible. So what do you do?
So for me, as a,
So if you need help, if you need to leave the town once per year. And I had this situation last year when I had to leave the country. I didn't find anyone to come to live in my house for 1 month to take care of my husband. No home facility, no nurse, because he has respiratory problems, tracheostomy. So what am I gonna do?
that's really hard.
Thank you. I knew that.
Yeah, I sometimes didn't know, right? I wish that I had another answer for you. Home services from a discharge planning perspective with our short-term rehab patients, it's really hard to get in-home services. There's the workforce is very different from when I started working. So it's hard to find in-home care.
I think the minus for sure. I don't know how it's in other cities, but Sheridan, unfortunately, big minus, because again, unfortunately, there are so many people who need this.
Yeah, and the statistics are staggering for the number of people who are aging and have Alzheimer's and other dementias and other physical issues there.
And the people who I found, they asking for huge funds. Huge. And when I say huge, meaning over $40 per hour.
Yeah,
So if we put together, I should have paid more than 12,000 per month to actually for that person to work 3-4 hours per day, because this is the time which that person would have worked. Only to feed him, because he has feeding tubes, only to give him some medicine, not even medicine, there are some supplements. And to, I don't know, to supervise him, because he is fully infected. He writes, he goes to grocery if it's necessary. But from time to time, because of that tracheostomy, he needs to be supervised. So I had to bring someone else from another country to take care of him. That's why I started. And I checked every facility in Sheridan, everything.
it's really frustrating.
That's why I'm saying that it's a big minus. Or, and I'm sure few other person, so I see it.
Yes.
Right.
I've been told I have to.
We have another speaker coming on. So thank you, Dani. Your information was great. We really focused on not just the. Thanks for everything. We covered not only not covering the emotional part of this for both parties involved. About standing, it's okay to feel bad about having your family member go to the nursing home. It's okay for them to be happy to be the person too. That's kind of, sometimes forget that they could be happy there too. So now Dee is going to come up. She's going to talk about a journey that she had moving a family member to a different living facility. Welcome, Dee.
Thank you. Thank you for having me. And Dani presented a lot of the encouragement I would have offered also. When Susan called me and asked if I would consider doing this, she said, we like to have caregivers come who have done it well. And I had to stop and think long and hard about what does that mean to do it well. And I think some days it means I survived with my insanity intact, which some days was questionable. Some days it means that my mom or my dad or my father-in-law are, doing well and healthy and protected. But I was reading a book, there's a book called What Are Old People For? And in that book, they referred to the ODTAA syndrome. And that syndrome is one damn thing after another. So I survived the ODTAA syndrome. So I guess I've done well. My journey into being a caregiver started in 1998 with my mother-in-law. And at the time we were in Laramie, and she became a fall hazard, and she was living with my father-in-law. And she started developing a little dementia, I think, that was precluded with having a couple of surgeries. Anyway, she was in a nursing facility in Laramie, and I wish I would have known then what I know now. But in hindsight, the awareness that has been created for caregivers and for nursing care is really advanced in the last 30 years. I'm not sure what we would have wanted for her even existed at that time with what I know now. She was there for about 7 years, and my father-in-law then moved in with us in 2002, and he lived with us for about 12 years. So I've walked the walk of having a parent live with us long-term. He was cognizant. He was just needed, like to have somebody cook for him and all that kind of thing. And he was fine just listening to his music or reading. He didn't require a lot of socialization, and he drove up until he was in his 92 or something like that. We were in Laramie at the time. I also had a teenage daughter who was struggling during that period, so I was balancing what she needed along with doing the day-to-day stuff for my father-in-law, and my husband traveled a lot, so he was gone a good share of that time. There were a lot of dinners where it would just be Dana and I, my father-in-law, and he would say to me, "Do I need to turn on my hearing aid? Are you going to say anything I want to hear tonight?" We got pretty comfortable with each other. Quite a guy. So then Walt took a job in Sheridan, and we moved up here about 17 years ago. And Dana was still living with us, and then he had to have a colostomy. And we tried to have him at home for about a month, and it became aware that it was more than Walt and I could handle or what he expected of us. And he said to us, "This isn't what your kid signed up for. I need to go to a nursing home." And so we looked at a couple different facilities, and he ended up at Greenhouse and was there for about 1.5 years before he passed. Still very cognizant up to the end. And I felt like he made the decision that he was done and all that. And so we walked that walk, and he passed away and moved out in 2014. Well, in 2014, then my parents sold their home in Laramie that they'd had for 60 years. And were going back and forth to Florida and had a home down there for about 20 years. But in 2014, they sold the house in Laramie and then started coming here in the summertime. So they were relatively healthy. Dad had COPD and a few things, but he was relatively healthy. Well, in the course of about 4 or 5 years, Dad developed more and more physical problems and needed more and more help. And I am the oldest of 5 girls, and my parents were both oldest children. So I had that caregiver take responsibility gene runs pretty deep in my soul. And had to go back and forth to Florida numerous times to help with Dad, as did my sisters. I'm very blessed that I have with 4 sisters. We get along pretty well and see eye to eye on things. And so they went some, but I went and did a lot of the care down there where Dad would have surgeries or needed a PICC line that needed monitoring and that kind of thing. And then it became apparent that they knew they needed to be closer to where we were or where family was, because he was needing more and more help. So in the middle of COVID, in 2020, we moved them here, and they moved in one of the cottages at Sugar Land. And I have to give Wayne Gray a little kudos because he was driving the bus at Sugar Land at that time, and he was truly a godsend. At that time, and when you live in the cottages at Sugar Land, they will provide meals for you. You can go to the main building and have meals and take part of the activities. There's no nursing care assistance there, but you can go over there. And so in the middle of COVID, when they had to shut down the dining room, they would bring meals to the house. And so that went on for, I don't know, 9 months or something like that. So we saw Wayne a lot because he was one of the meal deliverers. And then that was in June of 2020, and my dad had numerous physical ailments, and he was he was cognizant, he was a strong manager, and so he managed a lot of what he needed. And it was about in the first part of September, he said, I think I've done everything I can do. He had Bell's palsy, so he couldn't swallow, he had COPD, he had bladder issues, and, aches and pains and whatnot. And so he said, I think I've done everything I can do. And on a Friday, he said, I think it's time to call hospice. And so we got hospice in on Friday, and he did the interview, and by Tuesday he had passed. So when the summers that they came and stayed with us, he started developing issues then too. And one summer he came and developed bladder cancer, and so had to stay through the winter. So I've also had the experience of having my parents live with us when they needed more than just meals and needed, some medical care and stuff too. So I walked that walk. And now my mom stayed in the cottage. When we were in Florida, Dad was telling us that Mom's mental issues were not great. She wasn't doing mentally very well. But it wasn't until they moved here and we got to see the day-to-day stuff, we realized how much of a burden he was really bearing. And she developed dementia, and she was able to stay in the cottage for about 9 months by herself. And then it became apparent she needed to be in the main building at Elmcroft, Sugar Land, Cascade. And so she is 98 in a couple of months, and she is in Sugar Land, has dementia. We are very blessed that she's not got the kind of dementia where she gets angry. She just doesn't remember anything. She doesn't remember if I've been there that morning, or she doesn't remember if she had breakfast, or that she even has a room upstairs. She doesn't remember that, but she's not an angry dementia patient. So we're very blessed that way. So that's been my journey through caregiving. And when the other thing that I told Susan and I was thinking about what my points were going to be is there's no way I can talk about this without talking about my faith. If it hadn't been for prayer, if it hadn't been for God and for the things I learned along the way and the answers to prayer that I got, I could not have done it. I just couldn't have. So when we were in Florida and we were dealing with the PICC line situation, and we're having to do daily put on compression socks. How many of you have had to deal with compression socks on the leg? It's no fun. It's very hard. So I just wanted to share with you a little insight into some of the encouragement I got from my faith. I don't want this to sound like a sermon, but I wanted to share that with you in prayerfully that maybe you'll get some encouragement from it, because it's a hard walk. Dani summed it up very well. It's a very hard walk to be a caregiver, and I haven't had it as bad. I haven't had a wife or a husband, spouse that I've had to take care of, or a parent that was mad because they had to go into nursing care. Both sets of parents went, pretty much made the decision themselves that this is what they needed to do. And so I know that there are walks through this journey of caregiving that are much tougher than I've had. But I wanted to share with you a little bit about one day that was particularly hard. And I just said, Father God, you know my frustration and trepidation about facing another day of Dad's frustration and anger. I pray the Holy Spirit would guard my tongue and help me to be a positive presence in Dad's challenges. You also know my disappointment is not seeing or feeling like my prayers for Dad's comfort are being answered. I know I can't know your mind or the mystery of your ways, but I could use some supernatural encouragement from you, as most certainly my dad could. Thank you that he is able to be resting this morning and for a full night's sleep. Help me to remember to be still and know that you, when the tensions are high and I am frustrated with him. I know he's dealing with his own anger and discomfort and needs to express it. I just pray he will spare Mom's hurt feelings. I read Proverbs 17:22. A cheerful heart is like good medicine. Please help me to have a cheerful heart in this uncheerful situation. Please forgive me, Lord, when I fail you, and please strengthen me for this day. Thank you for the resources to care for Dad and the caregivers who can come to and for the caregivers who do come to their home. Thank you for another day of protection for my family and meeting our needs. And then I relied a lot on the serenity prayer. And I don't know how many of you know the full serenity prayer, but it goes, Lord, please grant me the serenity to accept the things I cannot change. And then I would list out the things I can't change, Dad's situation, that kind of stuff. The courage to change what I can, which was generally my attitude. And the wisdom to know the difference, living one day at a time, enjoying one moment at a time, accepting hardships as a pathway to peace, taking this world as it is, as Jesus did, not as I would have it, trusting God will make all things right if I surrender to his will, and that I may be reasonably happy in this life and supremely happy in the next. And then a couple of days later, I was visiting. My prayer that day was help me to be for my dad, and this is when we were in the middle. It was a really difficult time. We were still in Florida at this time. Help me to be in tune with his need to process and move through all that needs to be done. Lord, I hear you tell me in Hebrews 12:12 to take a new grip with my tired hands and to strengthen my weak knees and set my feet on the straight path so that those who are weak and lame will not fail or will not fall and will become strong. I pray through the power of the Holy Spirit that I can do just that for Mom and Dad. I continue to pray Satan and his methods of defeat and discouragement would be cast down and have no power over any part of my life or the lives of those I love. So at the end of the day, then I wrote, so Lord, taking a new grip and strengthening my weak knees message was made loud and clear this morning as I was helped Dad clean up from his bowel accident. And he expressed concern about the discomfort of being on my knees. Thank you, and I thank you for knees that can get down and accommodate what needs to be done. I didn't make the connection to your early morning message to me until I was on my knees cleaning both bowels. You are teaching me to help to honor and encourage the lame and the weak, to take up my cross daily and follow you. This is hard, Lord, and there's no way to prepare for it. I'm so thankful I know you and the strength that comes from that. So I guess at the end of the day, I just encourage you to lean on your faith, lean on each other. It's really important to have a support group. And I'm just really impressed with how many people are here tonight. So I encourage you to do that. A lot of the other things I was going to talk about or mention are things that Dani has already mentioned. We have had a wonderful experience at Sheridan. And I tell them over and over again that I think the assisted care and that we're getting anyway is as much assistance for the family as it is for your loved one. I would, if I can do anything to help encourage you to seek out assisted care or some of the resources that we have in the community, I would highly recommend that. When I was deciding about, when it came time to, after Dad passed and we were deciding what to do about Mom, I thought long and hard about bringing her home to our home. And I was still working, so that would have meant that she would have been home a lot of the time with my husband, who was retired, which he was very willing to do. He was very supportive and he would have been willing to do that, but I just didn't have a sense of peace about it. So I called Heather Comstock at the hub, who was the dementia-friendly representative, and she talked me through accepting that if you don't have a sense of peace about this, then it's not the right choice for you to make. And it's like she gave me permission to say, okay, Mom's going to go into assisted living and I'll come home and be with me. So that's pretty much been my walk. And if I can be of any encouragement to anybody, I'd be more than happy to. So thank you. Does anybody have any questions? No. Okay.
All right, what a great lineup of speakers tonight. Thank you very much, Dani and Dee, for being here tonight and sharing with us, and for all of you in your questions. And they have the door open so we can say, thank you for dinner, Angel and Caleb. And you'll see that not only does she have salad and other things like that, she's got several pastries and cookies and things like that. So be sure you grab something on your way out, and there's books over on the table. And in addition to everything else, you know, our pillars of brain health tonight is be social. Wasn't this a great social time in addition to everything else, to know that you're not the only one walking this walk? So thank you very much, and we will see you next week.